Let's discuss community medicine. What is community medicine? It deals with the health of community. You see, the health of community in community medicine are health issues of community. What are various health issues of community? So, we will discuss this lecture according to following learning objectives. Number one, we will see the definition of community medicine and its significance. Then, we will see the definition of health. Then we will discuss natural history of disease. We will define natural history. We will explain natural history of disease and various advantages of natural history of disease. Then we'll discuss epidemiological triad according to agent, host, and environment. In the end, we'll summarize the session. At the end of session, you will able to know about community medicine definition, about health definition, about natural history of disease and epidemiological triad. So let's start with community medicine. What is community medicine? Branch of medicine which deals with the health issues of community. Health issues of community are discussed in community medicine. There are various health issues of a community. Because spectrum of disease in the community is different. Spectrum of disease in clinic is different. We'll develop a comprehensive health system. What is meant by comprehensive health system? System which covers all the aspects, not only medical, it covers psychological and social aspects as well. This comprehensive healthcare is provided by a healthcare team. We have to develop a health team, or we have to train a health team which will provide comprehensive healthcare to community. Why? Improve health of community, improve health status of community. So, community medicine is significant. It has a role to play to improve the health of community. We'll do community diagnosis. What community diagnosis is? We will see the pattern of disease in community. What is the pattern of disease? We will see who is at risk, which people are vulnerable. Then we'll plan and implement. We'll plan to control the problem. We will do implementation. We will do implementation by a certain strategy. We'll train a health team. We'll allocate the budget. Then all this is done for prevention of disease or control of disease to reduce the burden of disease. We will monitor and evaluate the system, whether our interventions are successful or not. Our interventions are helpful in decreasing burden. They are helpful in increasing the health status, and we will predict the health status of community on the basis of this. What is prediction? We'll say that our community is healthy or not. We'll predict on the basis of mortality. If mortality is higher, our community is not healthy. We'll predict on the basis of morbidity. If morbidity is greater, then we can say that burden of disease is greater and community is not healthy. So we can say that all of this is done for prevention. All of this is done for control. We will achieve prevention. First we'll do community diagnosis. We will see the pattern of disease in the community. We'll do community diagnosis. We'll establish a system. We'll plan. We'll plan according to needs, according to requirements of community. That's why it is essential to know the burden of disease in the community, to know the pattern of disease in community, to know who is at the risk in the community. We'll plan. We'll do implementation. Only making a plan is not sufficient. We have to implement that plan. Implementation is done. Implementation has certain requirements. We need money. We need budget. We need a team. We need a strategy. We'll implement. Okay. After implementation, we'll monitor whether our system is working or not. We will evaluate. our intervention are successful or they are not successful, what changes need to be made, and we predict the health status of community. All of this has one aim, one objective: prevention of disease, improvement of health status of community. Our community should be healthy. Let's discuss the definition of health. Sometimes some people say that absence of disease is health. No. WHO says it is a state. It is a state of complete physical, mental. It is very important aspect of health, mental health, social well-being. Person should be socially healthy. Not merely the absence of disease. Absence of disease is not health. All these elements should be present. And infirmity or disability. A person is said to be healthy if all these three dimensions are present. He is mentally healthy, he is socially healthy, he is physically healthy. Let's discuss